what is the optimal dose of finasteride in your opinion? We know it's 1 milligram. Any doctor who is prescribing physician will tell his patient to take 1 milligram a day. But based on your experience and based on your 15 years of prescribing it, what would be your answer to this?
See, I would divide this into two categories, broad categories. One is patients seeking hair loss treatment, and the other one is patients after hair transplant being recommended finasteride. So the dosage and the recommendations are different for both. Whereas there is a lot of scope for experimentation when we are treating hair loss. After hair transplant, there is very little scope because the margin of error is very less. You would agree with me that only in hair loss treatment, when we can start off with a low dosage and see where over a period of 3 months to 1 year, where the patient's sweet spot is, which is around somewhere between 0.5 milligram to 0.8 milligram on alternate days. Now, we don't get 0.8 milligrams as a package dose, nor is it recommended to split the medicines because the doses, actual dosage might vary. So it is 1 milligram for practical purposes. 0.5 milligram is the dosage that I usually start with on alternate days, and I gradually over the next 3 to 4 months, that is in the next one hair cycle, by the time new hair has sprung up, I decide whether to switch to a higher dosage or not. And most people benefit by either of these two dosages. So this is customized dosing. Every patient has a different dosage of Propecia or finasteride that would benefit him and make him have a head full of hair through medication. But you also have to see what is the age of the patient. If the age of the patient is, say, 23 years old and is rapidly progressing towards baldness, would you like to take a chance with a low dosage? No, I would not like to. I would like to stabilize the baldness as fast as possible with all I have, and then after that gradually decrease or wean off the patient to a lower dosage that will benefit him and his peculiar metabolic system without the optimal dosage with minimal side effects.
So in case of more aggressive baldness, somebody who is very young, you would like to start with the highest possible dose, ideally, so you can stabilize it quickly and then go maybe less in the future.
Exactly. And many times I've found that people who are around 20 years, 21 years old, aggressively balding, even 1 milligram a day does not suffice. So in these patients, I like to put them on once a week dutasteride, 0.5 milligram on weekends, say Saturday, and on Saturday I omit their finasteride dosage.
So we will talk about dutasteride more in another question, because that's something that's more potent than finasteride. And as Dr. Bhatti already said, some people will not see stabilization with finasteride because their hair loss is too aggressive. And in such case, there will be another addition of dutasteride. But that still means taking finasteride on other days, but adding dutasteride on another specific days a week. So you would essentially say by an average maybe hair loss progression that is not super quick, it's not super slow, that it's also enough to start with 0.5 every other day and then see how it goes for about 3 to 6 months and then adjust from there.
You're right.
Yeah, that also goes hand in hand with the general recommendation of other doctors on the hair loss show from Australia. They're also proponents of taking 0.5 milligram every other day for people who are already worried about the side effects, which actually can exacerbate the side effects experience in itself. So it's actually better for these people to start with less, since they already maybe are making themselves more susceptible mentally towards the side effects. So that's actually a smart thing to do. And I would agree with that, definitely. Personally, I started with 0.5 milligram every day back 4 years ago. I also used it. I never used 1 milligram a day. I either used 0.5 a day or 0.5 every other day, and it also worked for me without losing efficacy, and it kept my hair. So if you get value out of this video, make sure you give it a thumb up, subscribe to the channel, and once the whole interview will be available to watch, I'm going to put it right here so you can watch the whole podcast. Until next time.